Hello, my name is Francisco. I'm going to read the practice 50 to practice to chapter 50 and chapter 12. Medical practitioner practitioners in Britain, doctor also known as medical practitioner must be qualified, have a university degree in medicine. They must also be re- registered, included in the General Medical Council list or registered in order to practice. A doctor who treats patients as opposed to one who only does research is called a clinician. A doctor who provides primary care for patients is known as the general practitioner or family doctor. GPS usually work in group practice. Large group practice work involving health, health centers. Note: in British English the verb is spelled practice and the noun is spelled practice. Specialties. Specialty doctor, for example, pediatrician. Pediatricians generally work in hospital. However, those who work outside the NHS providing private health care may have consulting room outside a hospital. For example, in famous Harley Street is in London. The two main branches of medicine are surgery and international medicine, and the doctor who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and female Miss. So, dear Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist specializes is a specialist in diseases of the heart and circulation or cardiology. Geriatricians specialize is in specialist is disease of elderly patient or geriatrics. An anesthetics special specialized is a specialist is anesthetic. Name of a specialty. Let me see. Name of a specialty usually end in ology. Name of a specialist usually ends in ologist. If the name of a specialty ends in ys, yes, the name of the specialist and in issues. There are ex- some exceptions. Anesthetics, anesthetists choosing a specialty. Jill Matthew has just graduated from medical school and is talking about her future. I have I have decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I working with children. I certainly prefer to work with children than say elderly patients. So I don't fascin geriatrics. I was never very interested in detail anatomy. So the surgical specialty specialty like neurosurgery neurosurgery don't really real apple. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operation several times and if done some minor ops by myself, but surgeons have to be able to do the same things again and again with without getting bored. Like think of cut arteries and so on. I don't think that will be a problem for me, but they need to make the sections fast, and I'm not too good at that. I like to have time to think. With me, surgeons probably not right for me. The collocation good with follow by and on is good with children. The collocation good at is followed by the aim for gerund of bear of by and on. She good she good at explaining producer. She good to explanations. The exercise is reading sentence to describe the work of the specialized in each branch of medicine. Look at a bit opposite to help you. Dermatologist. A dermatologist specializes in the disease of skin. Rheumatology. A rheumatologist specializes in disease of the joints. Traumatology. A traumatology specialized in accident and emergency. Pediatrics. A pediatric specializes in disease, disease affecting children. Obstetrics specializes in management of pregnant women. Complete the table with word for A, B, and C opposite of the relate from put a street mark in front of the street syllable in each word. The first one has been done for you. Verb specialist. Noun person specialist. Noun activity or thing specialty. Practice practitioners. Practice consult consult consultant. Consultation. Assist assistant assistance. Graduate graduate graduations. Qualify qualify qualification. Fin preposition. Find prepositions in C opposite that be used to make word combination with the word in the both. Then use the correct form of the word to complete the sentence. Good, interested, specialized work. A pathologist specialized in a diagnostic disease trials, examination, examining cells and statisticians. A pediatrician must enjoy working with children, and an oncologist is interested in the diagnostic and treatment of cancers. A physiatrist must be good at counseling. A neurosurgeon must be good with her hands. Make word combination using a word from each both. Two words can be used twice. Look at and B and C opposite to help you. Consulting room, general practitioner, general practice, group centers, internal medicine, surgical specialties. Medical practitioners, hospital staff. The people who work in any type of workplace, including hospital, are called the staff. The medical staff in British hospital belong to one of four main groups. Mm, a pre-registration host office PRHO or house officer is a newly graduated, let me see, mm, doctor in the first year of postgraduate training. After a year, he or she becomes unregistered medical practitioner in the current system of training. The Foundation Program. The name for this junior doctor is Foundation Years 1 Doctor Fay and Y1. A Senior House Officer CHO is in the second year of the postgraduate training. The leader is now Foundation Years 2 Doctor Fay Y2. Both the word-term senior house officer and SHO are still used. A senior house specialist register. Specialist register SPR is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registers, doctors who have completed their training but do not wish to specialize yet. A consultant is a full qualified specialist. There may also become associate specialist, senior doctor who do not wish to become consultant. In addictions, there is at least one medical or clinical director who is responsible for all of the medical staff. Medical teams, consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for the patients. In many hospitals, There are multidisciplinary team which consists not only of doctor but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the wards where they will receive treatment and care. The junior doctors clear them, take their medical history, and examine them. Same day later, the register of sees the patients and may order investigation or test, for example, X-ray rays of or an ACH, make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds when the management of the patient is discussed with the registered consultant. Also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patient in consultant care. Chief. Junior doctors now normally work is in shift, which means they normally work for 8 hours every day, for example, 7 a.m. to 3 p.m. and are they free until 7 a.m. the next day. After a weekday change, a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is work from 9 a.m. to 5 p.m. every day and to take turn next day. Days on are set out in a route are an or list of name and time. Doctor on call carry a radio page or bleeper and device which make a noise when someone is trying to connect them. Yes. Make word combination using a word from each bus. Look at A, B, and C opposite to help you associate with specialized. House with officer. On with call. Provisional with diagnosis. Grade with payer. Work with role. Match the description with the job title. Look at A and B opposite to help you. Dear Grant or Dr. Grant has been a pediatrician for 8 years and is responsible for treating the children admitted to work system consultant. Dr. Stewart has just started the second year of the foundation program SHO. Dr. Singh has started his training as a surgeon specialized registrar. Dr. Philip has just graduated and is working in a large hospital in Birmingham, PRHO consultant. Dr. Miller is in charge of the medical staff in the Brigham Hospital, medical director. Are the following statements true or false? False. Find reason for your answer in A, B, and C opposite. A medical graduate becomes registered 2 years after graduation. Is F. The system of training doctor in Britain is called the foundation program. Is T. True. True. The name senior house officer is no longer used in British. Is F. The consultant is usually the first doctor to see new patients. Is F. When working in shift, all doctors take turns to be on call. Is F. Complete the text of PRHO describing her job. Look at A, B, and C. Opposite to help you. When I get to the war, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the church nurse. He tells me if there is anything that needs to be done on your team, such as intervening lines to put up or take down. Later in the morning, clerk, any new patient, which basically involves taking a history on Tuesday and Friday morning. The consultant does her work round, and I have to make sure I'm completely up to date on her patient. After that, there are usually lots of things to do, like waiting up request for form for blood test and so on. In the afternoon, I have to prepare for any patient who are to be discharged the next day. They're usually happy to be going home. And then, of course, there are the lectures and tutorials in the training foundation program on Monday and Wednesday. Let me see. Yes. Nurse. Nursing grades. Nursing working in a hospital has the following grades: student nurse, a nurse who is still in training; staff nurse, a nurse who has completed the training course; charge nurse, a more experienced nurse who is charged of or responsible for a work or department, department. Nurse manager, 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 a nurse who is charged of several wards. Dr. James is talking to Sister Watkins. The word term sister is still sometimes used for female charge nurse or female nurse manager, may be called matron or matron. Support support worker. The clinical support worker who has done a short course and obtained basic qualification, and nursing auxiliary who is usually unqualified but assistant nursing staff. There are many also be ward clerk whose duty include making sure patient notes and information are up to date and answering the telephone specializations. Like doctor, nurse can specialization, midwife has especially from the beginning by doing course in midwife, the management of pregnancies and children. District nurse visit patients in the homes. Health visitor also work in the community, giving advice on to the promotion of the health and the prevention of illness. The nursing roles, the nursing role has changed considerably in recent years. In addition to general patient care, shaking checking temperature, pulse rate, and blood pressure, shading, dressing, giving injections, and removing suture. Nurses know done some of the things previously reserved for doctors, such prescribed drugs and ordering the laboratory tests. More responsible for nurses is explained as the following article is demonstrative. North Star of surgery is effort to put patient waiting list. Northern is Scotland training the performance minor surgery have entered the operation theory of the first time in an effort to cut patient waiting time. Five nurses who have processed a new course gloves of Caledonian University are not qualified to carry out such procedures as removal of small lesions, begin most and cyst. The birth performance and carry out are usually with all type of procedure. They are often used in the possessive passive form. Perform, carry out an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed, carried out by a nurse. Complete the sentence. Look at A, B, and C opposite to help you. Some who specialize in the delivery babies is a midwife. Someone who is qualified to assist nurse is clinical support worker, someone who is not qualified but is able to assist nurse is nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is health visitor. A nurse who looks after a ward is charge nurse. A nurse who works uh, in the community is district nurse. Someone who answers the ward's telephone is ward clerk. Make word combination using a word or phrases for each bus. Look at the possibility to help you. Carry out with a procedure. Charge with a dressing. Shake with the temperature. Give with an agent injections. Remove with suture. Complete the sentence with the correct grammatical form of perform. An isotope brain scan is painless and is easy to perform. Biopsy of the pancreas was performed last March. If the patient condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year we performed a remote double-blind group study. Complete the sentence with the correct grammatical form of carry out. I now intend to carry out a large study. Unfortunately, few properly controlled trials have been carried out. A number of studies have been carried out recently to look at the occasions. A right hemicolon- hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Unit H.